passage of health care reform added significant improvements to Medicare, but unfortunately, too many seniors don't even realize these new benefits exist.
I know very little about the Affordable Care Act and the Medicare reform.
I think if more seniors knew that this was available to them, then they wouldn't be so apprehensive about reaching out.
Unfortunately, the long, contentious debate over health care reform was marked by misinformation and fear about what the Affordable Care Act would mean for Medicare. That's where the Patients Aware campaign can help. Our goal is to ensure America's seniors understand the benefits available to them so they can take full advantage of the new health care provisions offered in Medicare.
That old saying, an ounce of prevention is worth a pound of cure, is especially important and true for seniors.
As you get older, you sort of run out of runway, and you just, if you get sick, it could be a disaster.
The Affordable Care Act keeps seniors healthy by increasing access to preventive care through the elimination of copays and expanding prevention services. Did you know Medicare now pays for an annual wellness visit?
Your preventative measures become very important later on in life.
That's something that was new to me. I did not know that until just very recently, that there were several categories that are included in the preventive maintenance visits. Didn't know that.
There are also incentives for better care coordination and reducing hospital readmissions. And this is just the beginning. You can see a full list of Affordable Care Act benefits for beneficiaries in Medicare online here.
Eliminating the donut hole alone was very profound and significant change that the ACA brought.
There's a couple of prescriptions that run $300 for 30 days. That's like $10 a pill.
The Part D donut hole has trapped millions of seniors in a cruel coverage gap where they pay premiums but get no drug coverage. What this reform will ultimately do is put real health care dollars back into the pockets of seniors who need them, and not to the insurers who've profited for years from this flawed provision. But there are other important changes to Part D too, such as improving low-income seniors' access to plans with zero premiums, and to important classes of drugs like anti-cancer drugs and immunosuppressants. And there will be new penalties for companies who target seniors with misleading or false marketing campaigns trying to enroll them in their Part D plans.
If you change how you deliver care to the really sick, high-cost population, you can actually have them have a better life at home, and you can lower the overall costs.
We have to provide consistent primary care and prescription drug benefits to older Americans who are living longer and having more chronic disease and need medical help.
The Affordable Care Act strengthens Medicare's fiscal health by adding years to the program's solvency. By phasing out overpayments to private insurers and negotiating rate reductions to providers, hospitals, and drug makers, this reform saves billions in costs without cutting benefits. Some of those savings will also be reinvested back into the Medicare program, slowing the increase in Part B premiums. Your access to doctors is preserved, but we still need a permanent fix to the doctor reimbursement issue. Medicare is also innovating with new ways to provide more effective and efficient care to seniors through programs like home-based care.
There is a real opportunity, both with healthcare reform and some of the Medicare reforms that came through in that law, and also with some innovations going on around the country to change elder care from kind of office and hospital and nursing home based to being really patient-centered.
You know, we're not asking for a lot. Just let us give her a good few years that she has left.
Since 1965, Medicare has been protecting the health and well-being of our nation's older citizens, and Medicare will be stronger thanks to health care reform. Now it's vital that America's seniors learn everything they can about these new Affordable Care Act benefits so they can improve their quality of care and quality of life.
We can't afford not to have Medicare because it's pay now or pay later.
We want patients aware.